To work in a field where you can change the trajectory of a child's life. Who would not want that job? To learn about the science of behavior, to basically learn about learning, to connect with families, and finally to learn perspective, to see the world through a child's eyes while simultaneously teaching them to see a bit more of their world every day and to connect more with their world every day. That's ABA. That's ABA at Acorn. And so congratulations on falling probably accidentally into this field of applied behavior analysis and connecting with this great company, Acorn Behavioral Health. My name is Greg Hanley. I'm the CEO and founder of FTF Behavioral Consulting, located in Worcester, Massachusetts. I'm also the clinical advisor to Acorn, and that has several meanings. The first meaning is that my group, we have a bunch of lead behavioral consultants, doctoral level BCBAs at FTF, led primarily by Dr. Kelsey Rupel. And this team supports the clinical leadership at Acorn to do assessment and treatment processes for children, adolescents, and adults who have severe problem behavior or who are at risk of developing severe problem behavior. And my team supports the clinical leaders to such an extent that they are now clinical leaders themselves, and they are imparting capacity to employees at Acorn on how to do effective and humane assessment and treatment processes for severe behavior. That's probably my primary role as clinical advisor, is to monitor that dissemination and competence building process. However, I also have the fortune to work with Krista Bowe, who leads the Grove, which is a leadership course for clinical folks at Acorn. And I participate in the Grove and try to help Krista kick that off and get people inspired to do better and to always do better in their roles at Acorn, and to teach others to do the same. Finally, I also facilitate with some other folks at Acorn Grand Rounds. And Grand Rounds is a nice opportunity for behavior analysts to present challenges and, importantly, their successes in those challenging contexts to their colleagues at Acorn. And by so doing, they're enhancing their communication and presentation skills, but they're also teaching their colleagues at Acorn that they're not alone, that these are shared challenges and we can overcome them. And Grand Rounds is just beginning, but I think it's going to be a really fun part of the dynamic at Acorn. One of the reasons I'm really happy to serve in the role as clinical advisor to the leadership at Acorn is because members of Acorn and myself and members of my team at FTF, we share the same values. And it's very important to us that values trump procedures, or said another way, that our priorities trump procedures. Meaning, when people don't know what to do, we always say, look not for the better procedure, look towards your priorities. So you have to have them in order to do that. The priorities at Acorn are first, safety. Safety is number one. If we don't know what to do with a child in a given situation, we ask ourselves, what would be the safest thing to do right now? That's probably the thing to do. Okay, the second priority is rapport. It's about relationships. It's about building relationships between yourself and the child, between yourself and the family, between yourself and your supervisees and your supervisors. It's all about relationships. And so again, what do I do in this given situation? It's not about strategies and tactics. It's about what would build the relationship at this moment in time. That's probably the correct answer. Again, always going back to our values whenever we're in tight situations. And then the third one, it's a made-up term, admittedly, but it's called televisability. It means that everything we do with a child should be able to be aired on the evening news. And for other people to see that interaction between you and that child and to say, I want that for my child with autism. That looks beautiful. That looks humane. That looks respectful. That looks joyful. It's about the televisability of what we do. So at Acorn, we care about outcomes and we produce great outcomes, but we do so because of the guiding light of our values: safety, rapport, or relationship building, and the televisability of what we do. When we embrace those values, good things happen both for us and for the families and children we serve.